Welcome to OBGYN Academics. When we are talking about ureteric injuries, signs and symptoms which are often overlooked, those are either fever or flank pain or hematuria. There could be abdominal distension. If you see carefully, there will be urinary leakage from vagina after hysterectomy. There could be a possibility of peritonitis. There can be paralytic iliatus and there could be retroperitoneal uremia. This should give a strong suspicion of ureteric injuries, either pre of which we have not diagnosed or which we have occurred after a few days. In a post-operative patient with these different symptoms, when we do per speculum examination, we can see escape of urine through vagina. So that is a sign of there is some fistula and urine is leaking from the ureter. Second thing is when we ask patient about urinary frequency, patient might get urge to pass urine and patient can easily pass urine. This happens because another side of ureter is also working, that is draining into the bladder, and bladder is functioning normally. Third thing is when we are doing 3 swab test. In that 3 swab test, topmost swab which gets soaked with the dye, so that is a suggestive feature of ureteric fistula. After strong clinical suspicion, we can confirm our diagnosis of fistula by indigo carmine dye. This indigo carmine dye is given intravenously. After 10 or 15 minutes, this indigo carmine dye will enter into urinary system and it will start coming out of the ureter, and that is visualized which is coming out of a vault, which is seen after hysterectomy. So that is one confirmatory diagnosis of ureteric fistula. Cystoscopy is useful to find out side of ureteric injury. When you do cystoscopy, you can visualize trigon of bladder and opening of a ureter. From affected side, you will not see escape or dribbling of a urine or urine coming out of that particular ureteric opening. So you can easily diagnose which side of ureter is injured. Ureteric catheterization is also a great way to find out ureteric injury. Ureteric catheterization is usually done through cystoscopy. A small infant feeding tube or a specific ureteric catheter is passed from cystoscopy and introduced through urethral opening from bladder, and obstruction met where the catheter tip reaches the site of injury. This is also one of the great ways to diagnose ureteric injuries. Retrograde pyelogram is the most accurate imaging test to evaluate location and extent of ureteral injury. Under CT guided, a dye is injected and contrast CT is done. On this, we can find out exact site and position of a ureteric injury. Ultrasound is a non-invasive method. With this technique, we can easily diagnose hydronephrosis, which is seen on sonography, and with the help of that, we can reach to certain diagnosis.